The stage is yours.
I became vegan when I was 14 years old. I simply wanted to stay healthy. And I soon realized that a vegan diet is a powerful tool in preventing and also treating chronic conditions. And that's why I went to medical school, to help as many people as possible. During my clinical rotations, I soon realized that the standard of care for people with diabetes was counting carbohydrates. That's right. And what happens when people just watch their carbs and cut down on bread and potatoes and rice? What are they mostly left up with? The truth is that they usually end up eating more meat and cheese, which make their diabetes even worse. So I decided to change this. At that time, there was no study showing the benefits of a plant-based diet for people with diabetes. So I decided to conduct one. Around this time, Dr. Neal Barnard published his first paper showing that a vegan diet is 3 times better for people with diabetes compared with the conventional carbohydrate counting approach. And a few years later, my study was published looking in more detail at the underlying mechanisms. We showed that a vegan diet is actually able to help with oxidative stress, which is the underlying cause of diabetes, but also other chronic conditions such as cardiovascular disease and cancer. It's actually able to also erase the diabetes-specific signature on the cell membranes, believe it or not. So with all these exciting findings, you would think that 2 studies might be enough to just change the dietary recommendations for people with diabetes, right? But the reality is that most healthcare professionals still don't know about this approach at all. And for those who hear about it, sometimes they're just skeptical. And in many cases, they're asking for more evidence and they're asking for more mechanisms behind the dietary change and its effect on their body. Well, that's why our work is so critical, because we not only show the effectiveness of a vegan diet in reversing diabetes or at least significantly improving it, we also look at the underlying mechanisms. We're currently conducting a study with Yale University with Drs. Schulman and Peterson, who look at what happens when people go vegan. Using magnetic resonance spectroscopy, they look at the liver and muscle fat. Will this be one of the mechanisms why a vegan diet is so effective in tackling diabetes? Another study that we're conducting is in collaboration with Blue Cross Blue Shield of Minnesota. For this study, we're enrolling people with type 2 diabetes, and we're looking at the healthcare expenditures when people go vegan. Can we save money on healthcare expenditures when people go vegan? For this study, our aim is to get 300 people who will be on a vegan diet for 2 years, and we will have 600 people in the control group who will make no dietary changes. And we cannot wait to see the findings. We present the findings of our studies at medical conferences, and we also publish the papers in peer-reviewed medical journals, because we want as many healthcare professionals to hear about this approach. We want them to recommend the vegan diet to their patients as well. Together, we can change the future standards of care for people with diabetes and other health conditions. Thank you all for all your support of our critical work.